I've been using diabetes technology as part of sort of routine care for about 7 years now. And I think when I started using it, I was terrified. It was a really scary thing because you hear all these kind of horror stories about risk of DKA, risk of people using the pump incorrectly. And actually, as a healthcare professional, when you're seeing patients on pumps, you need to feel confident.
I think finance is a big deal. Awareness as well, to have these conversations. Sometimes if they haven't got the awareness, they can't have the conversations. The more you know about the devices, you can support patients who already have the devices. You can know how to use them safely in whatever environment the patient is in.
Uptake of technology, I think that's the real barrier that we're finding now, is that we've got the technology, we've got the data that says that it's safe and it's effective, but it's making sure people are encouraged to go onto it.
I think there are a few barriers, but one is around that actually diabetes technology is the responsibility of specialist teams. And as we mentioned, there's so many people that could benefit from this technology that don't even know they can access it. So if we can change that mindset and be really curious when we see people, the fact of being able to access this technology would be so helpful.
The protocols and guidance on eligibility for diabetes tech can actually be drawn quite narrowly, and they really don't take into account various factors. So, someone's quality of life and the impact that technology can help, and also other health conditions, someone's diabetes distress, their mental health issues, or occupational hazards, which actually, again, we know diabetes tech can be really helpful for.
What do I think King's Health Partners is? I think it's an organisation where we are coming together to actually raise the care for people with diabetes and other long-term conditions, so that we standardise access and to recognise that the goal is that it doesn't matter who you are. If you live in South East London, you're part of this family, then you're going to be able to access what you need, whether it's the care or the technology, to live a full and healthy life with a long-term condition like type 1 and type 2 diabetes.